Hi, my name is Ken Nepple. I'm a urologic oncologist at the University of Iowa. That's a urologist who specializes in the management of cancers. I'm going to talk today about how to manage a renal mass, or also called a kidney mass. For the patient diagnosed with a renal mass, there's a number of different concerns. Oftentimes these renal masses are identified just incidentally on a CT scan performed for other reasons. The patient may not have any blood in their urine that they see. They may not have any pain associated with this. And oftentimes, this may be a healthy patient with no other medical problems. With this new diagnosis comes a lot of concerns from the patient standpoint to make sure they're educated so that they have the power to make a decision that's best for them. Amongst the considerations in a renal mass is that for small kidney masses, many of them may not be cancer. For a mass less than about 1 inch in size, there may be an up to 20 or 30% chance that it's a benign mass and may not need to be treated. One of the considerations because of that is, should a kidney biopsy be performed? Through the skin, a small needle can be inserted to get a sample of that tumor, which a pathologist can look at under the microscope and see if they identify any tumor cells. A second consideration is, if we're suspicious about this mass, does it need to be treated? In small kidney masses, the risk of that tumor going somewhere else is quite low in some patients, especially those who are older or who have multiple medical problems. So there may be a select group of patients who don't need any treatment and who can just have their mass watched over time. We call that active surveillance. If treatment options are chosen, there are several different options. One of them is ablation, which is through the skin inserting a needle that goes into the center of the mass and can then either freeze that mass or bring it up to a high enough temperature that the tumor cells are killed. Traditionally, kidney masses have been managed surgically. However, there's a myriad of different options that are available in the management of a kidney tumor. This is a schematic of a kidney. You see the meat of the kidney here, the urine tube called the ureter, which drains the urine, the vessels to the kidney, and then our suspicious mass. In the case of this mass, traditionally the approach may have been to remove the whole kidney to make sure that the cancer control was adequate. That's called a nephrectomy. However, in the case of small masses, especially like the type pictured in this schematic, there may be an opportunity to remove just the kidney tumor and a small rim of normal parenchyma or meat next to that kidney tumor. The benefit of removing the small tumor and leaving behind the rest of the kidney is that there's better kidney function over the long haul. This can be surgery, either complete nephrectomy or removing part of the kidney, which is called partial nephrectomy. Can be done via open incision, or in some cases done through small keyhole incisions with laparoscopic instruments, especially if the mass is large enough that the whole kidney needs to be removed. However, for small kidney masses, there's clearly been a movement across the country, and especially at our institution, amongst approaching these masses with robotic assistance. In short, what that amounts to is rolling a robotic console up to the patient so that the laparoscopic instruments that are going inside the body can be controlled from the outside via the robot. That robot is controlled by a surgeon who sits at a console. What I do with my hands at this surgical console is exactly what the instruments do inside the body. So in the case of a kidney mass, it's clearly a good idea to be well educated about your options. I think it's never a bad idea to get a second or sometimes even a third opinion as to what the best management options are.